Today, how do we treat facial volume loss when someone's lost a lot of weight? Hi guys, welcome back to the channel. You are probably wondering, why am I wearing glasses? Apart from the obvious answer, well, clearly it makes me look more doctory. The second reason is because I literally just bought these and I think they're really cool, so I just wanted to tell you all about them. One of my friends was telling me that these are a thing, that they exist, and as soon as I found out about it, I was like, right, get me 3 pairs immediately. What's so great about them? Well, they are special lenses, so they block out the glare and a little bit of the blue light spectrum from, ambient lighting, and also from your computer as well. So if you're having trouble sleeping because you're not producing enough melatonin, these could be the eyewear for you. And they also kind of look a little bit cool as well, don't you think? Because, they're like a little bit geek chic. What do you think? I had my eyes lasered about 2 years ago, so now I can't wear glasses anymore. And I wouldn't exactly say that I regret it, because it was like literally life-changing, not having to think about wearing glasses or contact lenses or take them away with me. But I do sort of miss having the option to have face wear accessories like this. So this is what I'm working with right now. What do you think? The company, by the way, is called Amber Eyewear, and they have a really big selection of different frames, and you can also get them prescription should you wish to do so. Okay, so let's talk about our patient today. It can be really tricky when somebody has lost a lot of weight, because if they were previously bigger and then they lose that weight in a relatively short space of time, it really does go off the face, and you can end up looking a little bit heavier and the tissue's a bit more flaccid than if somebody had maintained a slim weight throughout their life. That's exactly the case of what happened with our patient today. So she went through a big weight loss program and lost a whole bunch of weight, and really felt like her facial tissues were feeling quite saggy. And you can tell if you pick up the tissue on your face like this, if you can pinch it quite easily and it kind of comes away quite easily and it feels quite flaccid, that means that the underlying structure just isn't there. What's my assessment? Volume loss in the temples. This brow is slightly lower than this one. Pretty dark underneath the eyes. This is a question that I'm often asked. What can I do about dark circles? Topical creams that you could try. There's one called Cerner XO. And using a vitamin C serum around the eye will also help as well. I mean, there's no easy answer to this quite tricky question. If it's pigmentation, hyperpigmentation, for example, from trauma or sun exposure, then using something which works for pigmentation will also work well here. So we do have a bit of volume loss there, and the quality of the skin underneath the eye is not great either. It's a little bit crepey. We've also got some nasolabial fold here which continues down onto the jawline, almost creating this sort of quite hangdoggy look there. She does have naturally quite good cheekbones, they're definitely there. So I think it'd be cool if we could sort of bring them out slightly. And the one thing that she was really interested in treating was the lip. So you can see that there's a discrepancy in the two sides of the lip. This side, the Cupid's bow is a little bit higher. We've got some flattening here. The reason for this bit of flattening is most probably because there's some asymmetry in the cheek. So you have a muscle which kind of runs down like this, and if your cheek volume here is not the same as it is over on this side, then the upper lip will not be the same. So if there's quite a big asymmetry between the two sides of the lip, it's not going to be possible to treat unless you fixed everything going on higher up as well. So what did we actually do? Well, as with everything, I started off by doing some Botox. So we did the frown lines, the forehead, around the eyes, DAO muscles, and the mentalis. That's kind of standard. Then I used some Radiesse along the cheekbone itself. The reason I use Radiesse is because she really needs to get quite a lot of lifting here. We do have some quite heavy facial tissue, and Radiesse mil for mil will tend to give you a little bit more lift than hyaluronic acid will. It's not for everybody. Some people don't like the immediate post-procedure swelling. Some people don't like the idea that you can't dissolve it either. It does go away on its own. It's not a permanent filler, but if you are somebody who's maybe new to these treatments or a little bit cautious, then Radiesse is not the treatment for you. The next thing that I'm doing is using some Juvederm Vollift in the front part of the cheek, again using 0.5 ml per side. We had to use a lot here. I think in total we used 1.25 mils per side. Then I used some Radiesse with a cannula along the jawline, heading towards the angle of the jaw. And again, we used a lot here, so we did 1.5 mils per side. Then that takes us to 8 mils. So you can see where we're going now. Now back for Juvederm Voluma in the chin. So we did the crease of the chin and the point of the chin and used one syringe for that. Then I treated just the base of the nose here, which is a super popular treatment. I do it all the time because it really does help to disguise this nasolabial fold and also pushes the cheek up a little bit. It's one of those kind of interesting treatments that unless you've seen it, you don't really understand what it does. Then just for a change, I used TSL Kiss in the upper lip along the vermilion border, and then the medial tubercle from the outside. I then did some lip tenting in the lower lip in the middle third. So I didn't really go wild with the lip. Then I used TSL Redensity 1 with a cannula underneath each eye. And this is going to look puffy for usually a few days afterwards. If somebody has got really poor skin, then I have seen it be puffy for maybe even 10 days. It does go away without taking action though, because this is an uncross-linked hyaluronic acid. It means that there's no links between the chains of hyaluronic acid. It's not a traditional filler. I'd say it's more akin to a mesotherapy product, except I just haven't done the multiple injections. I've used a cannula. And if you've seen some of the previous videos, you'll know that this product contains additional vitamins, minerals, and antioxidants to help support skin health. It does help to make the colour underneath the eye lighter. Obviously, there is a limit to how light you can go, but it will help a little. Now we've used 12 syringes. Next up, we're going to use some Redensity 1 around the vertical lines in the smile line area. And then I'm going to use a 32 gauge needle in the lip for the lower vermilion border, just in the middle third. Then I'm going to go back and do the upper lip with cannula. And then more Redensity 1 to the skin around the mouth. This is more about improving skin quality rather than anything else. Okay, so let's look at our before and after. Please ignore the difference in the hair there if humanly possible. So you can see that the eyebrows now, they are looking a little bit more congruent. We don't have this stray one disappearing up. This line underneath the eye, the shadow, has been improved ever so slightly. I do think that if she were to have more treatments done with the Redensity 1, we would see more of an improvement than we have got here. This is just with one treatment, and something like this does need to be done a few times. The before and after is only taken 5 weeks apart here, and there's only time to do one. We do have a little bit more evenness in the lip. So previously this side was kind of shooting up way higher. So I've made this side match a little more. Because of this heavy part of tissue here, I'm not able to rotate it round anymore. If you saw her in person, you'd see that there is this sort of fat pad just there, which is pushing the lip down slightly. So we did the best that we could there. And you guys can see how difficult it is to really get lift on somebody who's lost a lot of facial volume. You know, we've put, gosh, how many syringes in there now? 12 mils. And I still feel like we could do a bit more vectoring here on both sides. I am pleased with the overall effect, though. I do feel like she looks a lot less tired, and we do look just that little bit more lifted. But I think a second session would really be beneficial for her. Mainly just to cause a little bit of collagen stimulation here, so that we can make sure that the cheeks remain nice and high, even though the tissue itself is kind of a little bit on the flaccid side. Okay guys, so that's it for this week. I hope you enjoyed the video. If you have any questions or comments, let me know in the comment section below. Don't forget to subscribe to the channel and like the video if indeed you did like it. I will see you again next week. Bye bye.